Good morning. I would like to report to you the 10 years follow-up of the PRIMA study, which was the first study to investigate the use of rituximab maintenance in patients with follicular lymphoma treated in first line with immunochemotherapy. While rituximab maintenance was used in different settings, this was the first study to investigate such treatment in patients that receive immunochemotherapy. The results were published in 2011 and they had demonstrated the benefit in terms of progression-free survival for this patient, but we were eager to see whether this benefit will be prolonged with time. So what was presented during this meeting was a 10 years follow-up of this study. We were able to collect data for the vast majority of hundreds of patients that were in the study. The take-home message principle is that at 10 years, more than half of the patients that received rituximab maintenance didn't progress from lymphoma and didn't have to receive a new treatment, as compared to 35% of the patients that did not receive maintenance that were free of progression. Very significant difference, maintained benefit. The overall survival was not different between the two arms, which is easily explained by the quality of second and third line treatment, but clearly for patients that had received rituximab maintenance, there was a 30% reduction of the risk to receive a new treatment, which in terms of quality of life is very important for patients. During the same session, other investigators, especially in the US, reported results of rituximab maintenance after bendamustine rituximab, and indirect data presented during this session by Dr. Brad Kahl, for instance, indicated that rituximab maintenance after bendamustine rituximab also provided the potential benefit in terms of progression-free survival, and another study for our German colleague also demonstrates the same thing. So in total, I think that we have no evidence that rituximab maintenance is very safe after R-CHOP or RCVP, maybe a little bit more infection after BR, but in both cases, it does prolong PFS, and even if survival is not improved, I think that on the patient point of view, survivorships, I think it's an important benefit not to progress from your disease and not to get a new treatment. So I think it's good news for the patient, and we hope that we can still make further progress and continue to improve the life expectancy and the quality of life of patients with follicular lymphoma.